It bothers me when people suffer unnecessarily. Suffering is all around, is part of human experience. But if you don't have to suffer and you didn't know that you didn't have to suffer and just keep suffering, to me, that's a travesty. The problem with current conventional medicine is that people are not giving that kind of.
Was there one moment when you decided, I'm going all in?
I was trained in autism, because I was a psychiatrist. That's my domain. He was not trained, yet he was producing results with one simple IV treatment of stem cells. He was producing these results that I couldn't imagine producing in years. So how is he able to do that?
Welcome to Mick Unplugged, where we ignite potential and fuel purpose. Get ready for raw insights, bold moves, and game-changing conversations. Buckle up. Here's Mick.
Ladies and gentlemen, welcome to another exciting episode of Mick Unplugged. And today we are joined by a visionary physician, scientist, entrepreneur, author, one of the coolest people that I have actually ever met. She is transforming the future of health and healing. As a leading expert in regenerative medicine and stem cell therapy, she's pioneering breakthroughs that redefine what's possible for human potential. Please join me in welcoming the brilliant, the innovative, the trailblazing, one of my good friends, Dr. Joy Kong. Joy, how are you doing today, dear?
Oh, I'm doing fantastic. Thank you, Mick, for such a kind introduction.
Absolutely. Joy, you've been doing so much groundbreaking work in stem cell therapy. For you, it's probably second nature, right? You've been dealing and talking about that forever, but it's something that for the common everyday person like myself, it's just now starting to get a little bit of attention. So I'd love for Joy, talk to us about what is stem cell therapy? Why is it important? And what got you into it? I know that was loaded. So let's just talk about what is stem cell therapy for those that don't know.
Yeah, I have to tell you, the nature of the conversation about stem cells has changed a lot over the years. When I first started 8 years ago, when I tell people, hey, I do stem cell therapy, and the first question usually is, hey, tell me, what is a stem cell? Explain it to me. But now I don't get that asked that very much anymore. People ask me, okay, I know stem cells are amazing and they can help a lot of conditions, but I have this condition. Can stem cells help me? So the nature has changed a lot, which means that, there's just wider and wider recognition, acceptance. So I liken it kind of like a wildfire. It's catching on. You're not going to be able to stop it. I know conventional medicine doesn't like the fact that we're preventing people from getting sick, keeping them living longer, and then helping them not to get on medications or getting them off medications is not something that they enjoy seeing. But despite discouragement and suppression, such as not being able to run any ads on Google, Facebook, Instagram, anything mentioned about stem cells, even the stem cell training I provide to doctors get shut down. The ads get rejected because I'm going to be training doctors on stem cell therapy. Even that I couldn't even, it gets rejected all the time. So there's a systematic suppression, yet it's still flourishing. So to answer your question, what is it? Why is it so important? Why is it inspiring? When I encountered stem cell therapy, I had worked as a psychiatrist for 11 years. I was interested in, of course, mental health, but holistic approach to mental health. What can we do to make our body healthy so our brain, who's connected, that's connected to the body, can also be healthy? So there's already a holistic orientation on how I approach the brain health. So when I was looking at optimizing health, not only for my patients, but also for myself, that's when I encountered the whole field of integrative medicine, holistic medicine, or anti-aging medicine. And then I encountered doctors who are actually doing stem cell therapy. So that was very early on. These are pioneers. These are early adopters. But when I saw what stem cells can do, this is a completely new concept. We had never tried to put intelligence into people's body. We don't insert intelligence, right? So we insert molecules. So we've got all these synthetic molecules, which are drugs. We have these, herbal extracts, right? Herbal concoctions that we can give people, which is can be hundreds of molecules, but they're still just different molecules, and they can only do so much. But now, this is the first time in human history, we are giving people a full cell, which is like a little universe, which is something that human beings, as smart as we think we are, we still can't make. We don't know how to make a single cell, right? It's very complex. It's like a little universe. Yet within that cell, within that membrane, there's a nucleus. Within the nucleus membrane, there's the DNA. That DNA is the blueprint to how you can become a human being. So that is the secret. That's the code. And if we can give the body the cells which contains the blueprint, all of a sudden there's a potential we can regenerate anything we want. We're not quite there yet, but we can do something along that line that we can regenerate a lot of things. So that's what we're tapping into. It's the first time in human history we are putting intelligence that created us back into our body and use that intelligence to heal. So talk about regeneration, regenerative medicine. That's why regenerative medicine is so incredible, because instead of treating the body as something that we have to fight with, that we have to
Hmm.
conquer, we're actually treating the body like something that we need to nurture. All we need to do is get out of the way so the body's own ability is manifesting. And that's what we're doing with stem cells, because all of a sudden, if you don't have enough stem cells in your body and you don't have enough healthy stem cells in your body, you're just not going to heal very well. You're going to go down the aging and the declining route, because the stem cells are the engine behind how you can build new tissue and recoup from any kind of damage, whether or not it's injury or oxidative cellular damage. So any
Hmm.
damage, you can utilize stem cells to help you recover. So all of a sudden that we're tapping into the intelligence that created us.
That's amazing. So, I wrote down some notes as you were talking, and I want to go to the very beginning, though, right? Because on Mick Unplugged, we talk about your because, that thing that's deeper than your why, right? The reason that makes you do what you do, the purpose that you have. And so for Dr. Joy Kong, like, what's your because? Like, what's your passion? I heard it, right? I heard it, but I want you to articulate it. What's your purpose? What's your because for doing this?
It bothers me when people suffer unnecessarily. So that's what about suffering is all around, is part of human experience. But if you don't have to suffer and you didn't know that you didn't have to suffer and just keep suffering, to me, that's a travesty, right? Like I can't stand it. So I think the idea of reducing suffering started with my mom, who always had back pain. As a little kid, I was giving her massages and I just felt this, this thing in me, this energy that wanting to heal, wanting her to do better. And somehow I feel like I can infuse my healing thoughts into her back and get her to do better. This is like this thing in me. So that drive of reducing suffering, right? You don't have to suffer. And that's what's really powerful. And the problem with current conventional medicine is that people are not giving that kind of regenerative or healing power to the patients. So people, I call it like cliff hanging medicine. Like people are hanging by the nails, they're hanging on. So it's like, okay, I have diabetes or I have whatever kidney disease. So I'm just hanging on here. My doctor is helping me to hang on this cliff. There's nothing the doctor's doing to drag you, to move you away from the cliff. The doctor's just helping you to hang better. So that is not something that's exciting or fulfilling to do as a healer, right?
Yep.
If all I'm doing is to helping people to hang on the cliff better, it's a very unsatisfying and depressing way of practicing medicine. So if I can find something where I can just grab the patient by the arm, drag them off the cliff right here. Come stand on your
Mhm.
2 feet that you can feel good. You don't have to be living this constant fear and deterioration. And I'm giving you something that's just preventing you from falling. I don't want to do that. So when I encountered stem cells, even though I was a psychiatrist, right, specializing in brain health, but I'm interested in all health. However, I wasn't trained in orthopedics, in kidneys, in the lung, in the heart, right? In autoimmune, immunology. Yet I was producing results. I was yanking all these people off their cliffs, no matter what conditions they had. All of a sudden, it was like, wow, am I a powerful healer or what? I knew it wasn't me, it was the cells. So if I can just somehow put the cells in the body, The cells somehow will find their way. That's why it's so simple, so elegant. This is one of the most elegant treatments. It really doesn't, it almost, I feel like, doesn't take a lot of skill. Well, there is still a lot of skills, but it's so simple. And that's the beauty. I love simplicity. I love elegance because I think it doesn't have to be really complicated. If be, the intelligence itself is complicated. So
Yeah.
what you do doesn't have to be complicated. If the
Yep.
intelligence can make you, how complicated do you think it is? It's unfathomably complicated. And that's what we're tapping into.
Love it. So, Dr. Joy, huge fan of yours, huge follow yours. Again, I hear all the passion that you're talking about. Was there one moment when you decided I'm going all in? Because here's what I know about Dr. Joy, and I'm gonna reference some things that I know throughout this conversation, but you don't dabble, right? Like Dr. Joy, you go one foot in front of the other until you were sprinting all in, right? So what was that moment that said, I'm going all in on stem cell?
When I heard what it can do. So it's at first is a shock. So when that first doctor who told me that he used umbilical cord stem cells to treat an autistic kid and he was producing results. This is an anesthesiologist, trained anesthesiologist, and nothing right. Nothing. I was trained in autism, because I was a psychiatrist. That's my domain. He was not trained, yet he was producing results with one simple IV treatment of stem cells. He was producing these results that I couldn't imagine producing in years. So what
Mm.
how is he able to do that? Like to me,
Yeah.
first it is shock. It's like I can't believe there's something like that available. And I didn't know. And I was slaving away, throwing drugs at kids, making them go through all these therapies when I can do something so simple. It's like, gosh, what have I been missing? So that was the first one. And then when I heard just a little bit more about the science. So at first it's the maybe, you wonder if you just caught the hype. And then I need to investigate, is this a hype or is this solid science? And once I started to study and read articles after articles after articles, I couldn't believe this is such a active area of research from around the world. And then the evidence of different conditions were just, it was astounding. It was, what, they studied this? They didn't, I mean, that's what I presented at my class, all these different organ systems, all these studies. So once I saw the evidence, so from clinical manifestation, the real improvement in patients to the clinical and scientific evidence, once I saw the evidence is there, and then the real patient results. And this
Mhm.
one lady, she told me that how her fingers were, her swelling were going down. She had rheumatoid arthritis within a few hours after the stem cell treatment. And she could put on a ring her grandma gave her that she couldn't use for a couple years. And then she had increased energy, concentration, sex drive.
Mhm.
And it was like, whoa, you are vibrant. Somehow these cells can do that. And there's nothing in medicine that's going to make you feel right into conventional medicine that's going to give you that kind of vibrancy. Um, that's when I was hooked. And that's when I thought, I will be a fool, for my life as a healer to not learn about this, not tap into this. And I'll be irresponsible not to try to bring this to other people.
No, I love that. And, I'm a huge believer in stem cell, but everyone kind of is, or I shouldn't say everyone. You saw some people that are curious, right? Some people that are like, well, that sounds great, but how is that really truly happening? And I want to talk through the scenario that you just gave about arthritis. What particularly is stem cell treatment and therapy doing for those that have rheumatoid arthritis or arthritis? And why should folks be jumping and running to go do this now? Because I wholeheartedly believe in it, but I want to hear from you, like, for that scenario of arthritis, like, why is stem cells so powerful that other treatments aren't helping?
I think rheumatologists spend so much of their time trying to diagnose and differentiate different types of autoimmune diseases, and there are over 100 of those. But truth be told, I think they're very similar diseases. That's which is why so many autoimmune diseases there's no name for it because doctors say, "Well, I know you have something autoimmune going on. I can't put you in a category." Why? Because the body is so complex. If you have something going wrong that your body is attacking itself, that's what autoimmune diseases is. You're attacking itself. But everybody's organ systems are built differently. Some people have a weaker heart. Some people have a weaker, circulation systems. Some people have weaker kidneys. So things are manifesting differently in different people, but it's really the same underlying mechanism, which is immune dysregulation. Your own immune system is out of whack, is completely gone berserk, attacking yourself. So it's supposed to be your friend helping you heal, and now it's decided to attack on itself. And stem cell therapy has so much evidence on autoimmune issues because what it does is that it modulates the immune system. It will boost your immune system when your immune system is too depleted and too underactive. And it will calm it down when it's overactive and going kind of, haywire. So for autoimmune disease, that's one of the foundations of stem cell therapy. It's like the nut, a bread and butter. I think orthopedics, there are a lot of examples. Everyone knows, oh, this elite athlete, went somewhere and, fixed his knee or ankle, but that's one aspect, and autoimmune is another aspect that stem cell therapy just shines because it modulates the immune system. It's one of the most powerful things to calm inflammation.
So I want to go where you were going. One of the biggest myths I think is, well, yeah, stem cell therapy works for athletes, or it's affordable for athletes and Hollywood stars. Talk to the everyday person, Joy. How affordable is it? And again, why is it, in my mind, stem cells more for everyone, right? Not just the super elitist or anything like that. So talk us through the cost of therapy. Is it something that medical insurance covers? How often are you getting the treatments and everything?
Yeah, first of all, I would say 99.9% of the insurance companies will not cover at this point. They're all locked into the drug model, but some obscure and more fringe insurance type of organizations, and for example, there's one called Samaritan Ministries, and it's kind of a co-op situation that they do cover. I think smaller companies realize that if they cover something that may cost $15,000-$20,000 now, it's going to stick them $500, $500,000 or $1 million, you know, 20 years down the line.
Right.
So in the end, they end up saving themselves a lot of money. So as an organization, it actually works better for the patients and works better for them. So things are catching on. However, uh, right now, what I call stem cell therapy affordable, it's affordable to a lot of Americans. And even for common people, I've treated people who are teachers, who are, just blue collar workers. So they have, let's say you have multiple sclerosis or you have rheumatoid arthritis and you can't
Mhm.
work anymore. And it's going to cost you $15,000, $20,000 to get you back to work, to actually give you life back, give you a quality of life instead of declining or just hanging on the cliff for the rest of your life. Is actually has the hope of reversing a condition so that you can live a good life. And how much is that worth? So a lot of people actually recognize the worth of it. They are willing to borrow some money, maybe sell some, stuff that may not be necessary, and they will get the money. So $15,000, $20,000, which is probably the most amount people will pay for a single therapy at our clinic. And there's a range. The range is a little crazy. I'll just give you the range. It's $5,000 to $70,000. If you look at the range of stem cell therapy, I just heard somebody was, getting a $70,000 treatment, not even getting human stem cells, and then actually doing a lot worse, which is a whole other subject. I don't think you need to use animal stem cells. You really should stick with human cells. But the therapy, just to put things in perspective, just because you have insurance, you still have to make copays. Right. So it's not like the insurance is free. It's not like you don't have to pay copays. And how much is it worth? In the end, you're going to spend a lot of time and money arguing with insurance companies, and I've seen that all the time. I mean, people have their life and resources drained away with insurance companies. So, also to put into perspectives, anyone is not convinced, just watch Unnatural Selection on Netflix. Is about gene therapy. So this is about what happens when big pharma get into a newer form of medicine, which is changing gene expression, and I think they want to get into stem cell therapy as well at some point if they get stem cells. Trust me, the cost is going to go up. Right now, the cost is lower. When the big pharma gets in, because how much does it cost to have a drug go to market? It costs an average of $2.1 billion. So who do you think has that kind of money to take some kind of a therapeutic agent? It's do animal trials, multiple human trials, go through all the hoops with FDA and do the marketing and then try to recover their money. So it costs $2.1 billion. You don't think they're going to try to recruit that money from you? They will. So unnatural selection is a really good example. Well, I didn't know what they were going to talk about, how much the treatment is. In one therapy, it's $750,000 for a one injection. So that's what happens when big pharma gets in the game, right? So that's how much they want to charge to recoup their investment. That's a strategy, right? There's always very much a business. So just put things in perspective. And what's funny was that in that documentary, that patient, I think with muscular dystrophy, he was not getting any benefit. He got a lot of nausea, headache, and lots of bad side effects and no benefit. And I was thinking, gosh, if you had just come to my clinic and got a $15,000-$20,000 treatment, I can almost get okay. 90% of my patients will see benefits in their symptoms. So there's such a good chance he's going to see something. He's going to see some improvement because of how the cells work. The cells have this global, so not just go to fix one gene. We're actually targeting the anti-inflammatory aspect of the body, balance your immune system, breaking down scar tissue, rejuvenating your tissue by telling your local stem cells to repair the damaged tissue by forming new cells. And there's anti-cancer properties, there's tissue rescuing, a lot of tissue rescuing, telling cells that are damaged that they don't have to die. And there's fresh mitochondria transfer abilities, giving your body more energy to perform any biological function. And also angiogenic, forming new blood vessels to supply your tissue with nutrients. So if I know the cells can do all that, which the gene therapy cannot, right? Gene therapy is very single-minded. If I can do all that, that's why 90% of people are seeing benefits. We don't have to talk about, I just put out a video about why some people may not see benefit. There are all kinds of other potential reasons, including toxicity, infection, etc. But majority of people will see benefits and at a cost that actually is endurable, right? It's doable.
Yeah.
So
You know,
I think you really need to have, put things in perspective.
no, I agree. And I want to double down on what you're saying too, because I literally had this discussion. It was about 4 months ago, right before the holidays, with one of my really good friends talking about stem cell treatment. And he's like, the cost, I don't know if it covers the benefit of doing it. And it was around the $15,000-$20,000 mark. And I said, okay. And I almost said his name, so I'm not gonna say his name, but you know who I'm talking about because I know you're listening. The conversation was, okay, think about all the money you're spending. Forget the doctor's appointments, but in the prescribed medicine that you're getting, right? Think about all the money that you're spending there forever just to manage the pain. It doesn't even it just manages it. Like, it doesn't make it better, right? It just manages it. One time you can pay this, and potentially, because I know there's no guarantees, right? But potentially you could actually not only be pain free, but your body's going to start to get better. Like, your body's going to start healing and the things that you're having. And so that one cost compared to the next 5, 10, 15 years, if you get to live that long with the pain that you have, you're going to spend far more than that, like much more than that, just to manage pain. And that's what people don't understand. Like, again, I'm not saying that I'm against doctors, because I love doctors and everything that they do, and physicians. Dr. Joy might disagree, but I'm going to say a lot of things,
I
though, are
love my
built to.
colleagues. Many are suffering, but
Yeah, but a lot of things are meant to manage pain, not eliminate or heal, and there's a big difference in cost in that piece.
exactly. Yeah. So how much is your life worth? That I always think. So I was just talking with somebody, if somebody says I can, perform this treatment and get you to have less anxiety, less brain fog, and enjoy your life more, you can, go out and enjoy food. How much is that worth, right? So, people really have. So instead, if you don't want to have that kind of benefit and you want to just hang on to the traditional medicine, which a lot of people do. And I see that happen all the time. It's not like tragedy does not happen to humans all the time. People make those decisions. We've seen that throughout the whole COVID, the whole, the disaster, that how many people are making decisions that may not be the most beneficial for them. But nonetheless, they decided to do that. And I've seen that even with therapy. I've seen people who are taking traditional medications that have all these drastic effects that could, including death, then they're happy with because it's FDA approved because their doctor said so. But when they
Mhm.
come to doing stem cell therapy, they get scared. They said, oh, what it's going to do? I have other people's DNA in my body. And they're not seeing all the evidence, a mountain of evidence on stem cell therapy probably trumps all the evidence on any single drug that's approved by the FDA. And if stem cell therapy can end up triggering one of the serious side effects of any of these drugs, it will be shut down. FDA would say it's a dangerous therapy, will be shut down. Yet FDA is approving all those drugs all the time. So for people to think because it's FDA approved, so I'm comfortable taking it because my doctor recommended to me. And that is just, you're not thinking clearly. You're not thinking for yourself.
Totally agree. Totally agree. Dr. Joy, like really quick, I want to talk through what are some other conditions or things that stem cell therapy can improve, right? We've talked about rheumatoid arthritis, but I know there's other things that you can
Yeah.
use stem cell therapy for. What are some of those
Yeah,
things?
I definitely want to preface it, just so I don't get anybody in trouble here. Unless we're talking about using stem cell therapy to help reconstitute your entire blood system, right? All your white blood cells, red blood cells, or you're talking about acute graft versus host reaction. These are the two, as far as I know, the FDA indications for stem cell therapy. So everything else will be off-label use. So they're not FDA indicated, so I can't say, never mind, half of medicine's practice, maybe more than half is practice by off-label use. But however, I cannot make any claims that this can treat any condition. However, we treat patients, right? I'm a physician. I treat patients who happen to have various conditions. And what have I seen that people have benefited from? People with what kind of conditions that come to me? I've had people with, just from head to toe, just look from head to toe. Let's look at traumatic brain injury, very difficult condition. All these athletes, all the veterans, majority of them probably have traumatic brain injury. If you go through basic training, you shoot guns and the recoil is going to give you some kind of traumatic brain injury. Any sports, so it's very prevalent. And even I have traumatic brain injury. I don't even remember that I did anything, but when I did a brain scan, it showed that I had traumatic brain injury. So it's very prevalent. So I've seen it improving that particular condition dramatically, even though conventional medicine really have nothing to offer, literally nothing. Rest, try to eat healthy, don't be stressed. I mean, that's a mantra that we were taught as medical students. That's what you tell people when you try to be a little bit more holistic. You tell them
Mhm.
to take it easy, don't stress,
Mhm.
and eat healthy and do
Eat
some
better,
exercise.
drink a lot of water,
That's
right?
all we knew. They could cover that strategy within 5 minutes of medical school, right? That's your strategy. Just repeat that mantra and you're covering your whole preventative medicine methods.
There you go.
So anyhow, so brain conditions, we've helped people with Parkinson's, with ALS, with Alzheimer's, with MS, multiple sclerosis, with even Lyme disease that have brain manifestations. So, but migraines, incredible evidence, and we've seen great results. We've helped, reverse the patient, literally stop the patient's symptom when with trigeminal neuralgia when she was having 30 to 50 episodes after the fifth COVID vaccine booster. She started having these, pretty much right away, these just unrelenting trigen- trigeminal neuralgia. That's a very severe pain in the facial nerve, and yeah, I mean, on the trigeminal nerve. but facial pain. So to the point where she wanted to kill herself. So drastic improvement. So a lot of these have not been studied, right? There's no research study because there may not be enough patients, may not be enough funding to do a particular study. So that's why what we're doing on the front line is so important, that we're accumulating this first line. Yes, it's anecdotal, but tell me an anecdotal success of using your medication to help a person of, this magnitude of conditions. Even you can't even give me an anecdote, right? Give me an Alzheimer's medication that can reverse cognitive impairment to the point where what stem cell therapy can do, right? From a completely degenerated clock joint, unrecognizable clock, to actually a decent clock with the minute and hour arm indicated, a pretty reasonable clock. Show me a medication you have that can do that.
Mhm.
So that's the brain, and the autoimmune conditions, like we mentioned, it's a huge category. So whether or not it's rheumatoid arthritis, or lupus, or inflammatory bowel disease like Crohn's disease, the uh, 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 ulcerative colitis, or sarcoidosis, or other type of like a skin manifestations, dermatitis, or psoriasis. And then there are all kinds of chemical sensitivities. Again, is manifestation of your you know, immune system going out of whack. And then we go to internal organs. So for heart, so post heart attack, repair of the heart, regaining function, improving ejection fraction, sclerosis, right? People with blocked arteries, helping
Mhm.
to improve basically the flow of the blood and reduce high blood pressure. So you can literally reduce plaque. So there's research showing the aortic root cleaning up
Wow.
the plaques. Yeah, it's seeing is believing, right? You can see in the images, it literally helped break down this plaque tissue and clearing up the artery wall and helping you to form healthier and lining of the arteries. And we have people with different kinds of, if we're, talking about the brain, you can also talk about the peripheral peripheral neurological system, nervous system. The peripheral neuropathy, it can be very helpful. That's an inflammatory condition. That's a systemic condition. And we have seen incredible results with neuropathy. In conventional medicine, all they offer is B12. And then there's really not much that they have to offer. So stem cell therapy, we get seeing patients ditching cane or being able to use hands that they haven't been used for months. So, really, really beautiful results. And then when you look at so the cardiac issues that can be very helpful, lungs. I love treating the lungs, COPD patients, getting people off oxygen, off almost all COPD medications. I've seen people with lung injuries. Like we actually helped. I have a podcast on this. A 9/11 responder, one of our veteran heroes, but was in the pit after 9/11 for 8 months, got severe lung injury. He said half of his colleagues have died from this serious toxicity. People don't talk about the casualties of 9/11 goes way beyond what happened on that day. So all these people who are fighting, who are trying to save lives, they end up losing their lives because of this. So this veteran, his name is Ron Pastino. He thought he was gonna, he didn't know how long he was gonna live. So, but with 3 stem cell treatment at our clinic, he was able to show in his CT scan, his lung is cleared. I mean, this
Mhm.
is the first 9/11 victim that actually was cleared of lung disease. So for the lungs, and we have other people clearing lung lesions. So the lungs I love because that's the first. But when you give some stem cells through the IV route, the first place they go to is the lungs, the liver, the heart, and the spleen. So the lung is really well perfused. If you have problems, inflammation, injury, and scarring in that area, a lot of cells are going to stay right there. They're like, oh my God, you're screaming, you're sending signals to tell me to stay here and start working. So let me start breaking down your scar tissue, starting to bring the immune system on board to remove the debris, remove the toxic stuff, and then telling your local stem cells to make more lung cells, right? More lining of the
Mhm.
lungs. So that's the lungs. And we've seen benefits in people with kidney disease, preventing people from going on dialysis, or even getting people off dialysis. That has happened. Not everybody, but We have seen that.
Yeah.
And liver cirrhosis. I give a liver cirrhosis patient who was in hospice. He was probably given a couple months to live with big ascites, right? Swelling the stomach with lots of fluid, and barely had energy to talk. I could barely hear him. And within a couple months, not only gaining his strength with swelling going down, actually swelling was going down within a few hours of the treatment, started to go down drastically. So that there's all these different stages of healing with stem cell therapy. So the anti-inflammatory effects can be very fast. And then within 2 months, he went back to his provider, checked his liver, was normal. So there's some incredible, yeah. And we had a young patient with progressive cholangitis. So that's like a scarring and inflammation of the bile duct. And his liver was shutting down. So he was on the liver transplant list. This is a 17-year-old boy. And we gave him, I think it was 2 stem cell treatment. And now he's off the liver transplant list. And it's just beautiful, right? So that's the liver. And even reproductive system. We have seen people trying to get pregnant for a long time and couldn't. And then after a single stem cell treatment, get pregnant, not only pregnant, but, healthy delivery of healthy baby. So there's research in animal research, they actually showed it can improve fertility in perimenopausal rats and getting their ovary to be bigger with more follicles, secreting more of the estrogen, progesterone, and more hormones, and then and then with more pregnancies. Oh, little rats, I guess. So research is supporting that, and I've seen that clinically as well. And then some more obscure conditions. I've treated somebody with repeated testicular swelling, and there's no research on it. Nobody's like, I'm going to do research on testicular swelling, right? That's a little more on the fringe. It's not diabetes, not a major condition. So it's
Yeah.
going to be hard to find research data. So when I saw that patient, I didn't know if I was going to be able to help him because there's no data, but I told him what the cells can do. What we know the cells can do: anti-inflammatory, breaking down scar tissue, and helping with immune regulation, so that we can help prevent this repeated, possibly self-attack. That's why there's all these repeated swelling. So lo and behold, he already lost one testicle because of the repeated swelling and infection. So the urologist, the conventional medicine doctor, right? If I give you rounds of antibiotics, still not helping, let's just cut it off. So the urologist
Dr.
cut it
Joy,
off. Yeah.
a little sympathy here, please, for my male listeners. You're hurting us a little bit there.
Uh, I'm sorry. Yeah, I know. I know. Yeah. So this time around, this is a few years later, the other testicle is going off doing the same things. And his urologist is just suggesting the same tactic. Let's cut that one off. So he came to me. He said, Dr. Kong, I don't want to lose this other one. So can you help me? Can you help me? I said, I don't know, but it's really worth the try, knowing what the cells can do. And incredibly, within a few months, all the nodules in his testicles were gone. Swelling was gone. That testicle was saved. Yeah. That's that we're talking about some of the organs, right? So the brain, I didn't even mention autism. We do see a lot of autism kids. I've seen some really good benefits. And then we, of course, musculoskeletal, we inject to help with different joint repair and different tendon, muscle healing, and back, a lot of people with back problems. So we do a lot of that too. You can do it for people with just regeneration. You can inject for erectile dysfunction, right? You can inject directly into the penis, or just even through IV use.
Dr. Joy.
Ah,
Yeah. t- My mental pain.
okay. All
It
right.
sounds
Can't be
like it
too
hurts.
casual about this. Okay.
It sounds like it hurts. That's all.
No, it doesn't hurt. Doesn't hurt me, but it really doesn't. It looks scary, but it's amazing. We do numb the area, but really, it's actually the needle's so tiny. It actually doesn't. I mean, I think everybody, their eyes go big when they look at you, about to put that needle in. I tell them to please look away and just take a deep breath. It really actually is not bad at all. They could barely feel
So
it.
you say. So
Mm,
you say.
That I've seen that, and they say, "Oh, it's not as bad as I thought at all." Yeah, but you can also inject into the vagina and even clitoris. Like when you say, oh my God, injecting, as a female, that's when my eyes go big, right? You sure?
Yeah.
Inject. But apparently, yes, you can numb a little bit and you can inject right into the area. It's actually not as bad as you think.
You hear it all here on Mick Unplugged. We're here we're saving lives and marriages today with Dr.
I
Joy Kong.
bet you the word clitoris has not come up on your podcast yet, has it?
First time.
Ah.
First time, it might be last time. Just ma'am.
And also you can do facial rejuvenation. So you can inject directly into the face. We've had people with lesions, like lots of sun damage on the face. And it was pretty amazing what stem cells can do. Of course, hair restoration, right? People with hair loss. And, if you still have some hair follicles, then we can help. But if you have, you become completely bald and there's no hair, there's no follicles to work with, then it would be difficult. But if you have some thin hair there, then we can help.
Wow. Dr. Joy does it all. Dr. Joy does it all. So I know you're amazingly busy and you grace us with some time today. Again, one of my dear friends, an amazing follow on Instagram. I think we were messaging there and you were like, hey, I wrote a book, right? And I was like, oh, let me show you. I've been listening to your book for the past 3 weeks. And you were like, oh, like, really? So yeah, amazing book. By the way, I'll make sure we leave descriptions and links to that book. But what all
Right.
does Dr. Joy
Well, I'll just
Kong have
mention the
going?
name of the book here so your audience knows. It's called Tiger of Beijing. Yeah, if people want to know, it has nothing to do with medicine, but if you want a good book, that's like a novel. That's actually from real life because it's my memoir about how I got to America and how I survived the first 2 years. And that's a good one to read. But that give you a glimpse. I think it give you a glimpse about determination, which to this day is that kind of um, resilience and determination and not giving up kind of attitude that's driving me in what I'm doing now. Because yeah, I'm facing oppositions and facing things that are not friendly to me, right? But I know what
Absolutely.
I'm doing is the right thing to do. I'm
Yep.
bringing people healing, and I can't think of anything that's more rewarding and that's more positive for the world.
Absolutely. Absolutely. Dr. Joy Kong, where can people find and follow you?
I think one of the best places is my YouTube channel because it's full of good information about stem cell therapy or anything holistic when it comes to enhancing a person's health. Because I have a podcast, the Dr. Joy Kong podcast. So that's also posted on YouTube and also the podcast channels. But they can also just look at I have a website just about me. So joykongmd@gmail.com. So that has the information on everything I'm doing, including my clinic in Los Angeles called Chara Health. I founded a stem cell company that provides stem cells to doctors all around the country. And then there's an academy I founded where I teach doctors and my book and a cream I created called Chara Omni, which is a stem cell cream that's 100% natural. So everything about me you can find on joykongmd.com.
There we go. The amazing Dr. Joy Kong. We appreciate you so much, Joy. It's an honor to have you on. Again, one of my favorite people in the world. I'll make sure that all the links of everything that Dr. Joy mentioned are in the show notes and description. Dr. Kong, thank you so much.
Thank you so much, Mick. It's such a fun episode and it's really great chatting with you.
Absolutely. And for all the viewers and listeners, remember your because is your superpower. Go unleash it.
Thank you for tuning in to Mick Unplugged. Keep pushing your limits, embracing your purpose, and chasing greatness. Until next time, stay unstoppable.